Okay. Good morning, dear friends. We start our lectures. Today topics of our lectures is anatomical physiological features of digestive system in children. We change two lectures and lectures about anatomical physiological features of cardiovascular system in children will be elder than these lectures. Okay, I hope to see you in our lecture. Please register. Digestive system. Digestive system is the main of one of the main important system in human body, and this system has many functions, main functions for health and in general for life. Digestive organs includes the mouth cavity, esophagus, stomach, duodenum, small intestine, large intestine, pancreas, liver, and bile excreting tract. It so many different organ includes in digestive system. When start of organogenesis of digestive system. Among the various body systems, start of the digestive system occurs at a very early stage of embryonic development. To 78 days of the endoderm begins to primary intestine's organization. At the 4-week on the front of its raises, the rectus opposites anus appear. By the end of first month, 3 parts of primary intestines are planned: anterior, middle, and posterior. From the anterior intestine, the pharynx, esophagus, stomach, and duodenum develop with the rudiments of pancreas and liver. From the middle intestines is formed part of duodenum, jejunum, and ileum. From the posterior intestines, all part of the large intestine develop. On the 3rd month of fetal development is carried out bowel rotation moving thing, right to left behind the upper mesenteric and artery, and thick left to right from the same artery. In the first week of pregnancy, the endocrine apparatus of the gastrointestinal tract is laid with subsequent production of regulatory peptides, secretin, gastrin, motilin, act. Peripheral and central nervous mechanism of regulation of the gastrointestinal tract are laid. From 16th 20th weeks of the embryonic periods, the gastrointestinal tract begin to function. Just after 4, maximum 5 months, in uterus start begin function of gastrointestinal tract of child. Prior of implantation, the embryo in the uterine walls is powdered material of the yolk sac. Histotrypsin types of food. Since the formation of placenta by hemotrophic transplacental nutrition and 4-5 months of fetal development, when start function digestive tract together with hemotrophic or is amniotropic nutrition. The amniotic fluid contains all the nutrients and enzymes. Other sources of enzymes is the gastrointestinal sorry, gastrointestinal tract of the fetus, placenta, mother's body. Due to the high permeability of intestine tube, part of nutrients is absorbed without prior hydrolysis, which must be taken into account when feeding a pregnant woman in order to prevent the development of allergic diseases in child in the future. After birth, the child goes to lactotropic type of nutrition, or nutrition by mother's milk, lactotropic types. Oral cavity. Oral cavity of a newborn and infants is relatively small. In the newborn, lips are thick, their inner surface are transverse rows. The circular muscles of mouth is well developed. Cheek in newborns and young children are rounded and convex due to presence between the skin and well-developed cheek muscles surrounding fat body. Fat lumps Bichat. Fat lump Bichat is specific um, uh, part of which from 4 years gradually atrophied. You can see it's here. It's fat lumps Bichat. What? Fat lump Bichat. Venom does not concern the posterior pharyngeal wall, which provides the child the opportunity of breathing during sucking. With the appearance of milk teeth, there is a significant increase in the size of the alveolar processes of jaws. And the weight of the hard palate rises. Tongue in newborn short, wide, thick, and sedentary, occupe the anterior oral cavity. You can see here the occupe the anterior oral cavity. The oral mucosa in children, especially young children, is thin and usually vulnerable, which should be taken into account when processing the oral cavity. The mucous membrane of the bottom of the oral cavity forms a noticeable fold, covered with a large number of villi. On the mucous membrane of the cheeks, in the gap between the upper and lower jaws, a protrusion or in the form of a rollers is noted. Transferred fold rollers are on the hard skin, lower like a thin casing on the gum. All this formation provides seal of oral cavity in the processing of sucking. It's very important mechanism for processing of sucking. Anatomical structures for this. On the numerous membrane in region of the hard palates in the middle line in newborns located nodules bone, yellow sheep education retention cyst of the salivary glands. You can see in this photo downstream, not here. The nodules disappear by the end of the first months of life. The oral mucosa in children in the first 3-4 months are relatively dry. This is due to insufficient development of salivary glands and saliva deficiency, more correct, yeah? Saliva deficiency, remember, about first 3, maximum 4 months. After this, we have salivary glands function. Features of salivary glands in newborn. Repeat once more. Low secretory activity. Isolation of a small amount of thin viscous saliva seal of the oral cavity during sucking. It's sealing. Yeah? The reaction of saliva is neutral or slightly acidic. Amylase concentration is low. Amylase concentration. The functional activity of salivary glands increase in 1.5–2 months. In children under the age of 3–4 months, the salivary often flow from the mouth. This is due to the immaturity of regulation of salivation and ingestion of saliva, physiological salivation. The acidity of saliva increased with age. From the first day of life in the saliva includes alpha amylase and other enzymes necessary for breakdown of starch and glycogen. In newborn during the first years of life, the content and activity of these enzymes increased significantly. True infant has a final shape. The entrance into the larynx is located high above the lower posterior edge of the palatine satin and is connected to oral cavity. Food moves to side of protuberant larynx, so the child can simultaneously breathe and swallow without interrupting sucking. Its physiological function in adult age, it's never been. It's according to very interesting anatomical features of throw infant. Function of oral cavity. You must remember about it. It's analysis of taste, properties of substance, weighting with saliva of food, initial hydrolysis of carbohydrates, formation of food bolus, irritation of mechano and thermoreceptors, causing irritation of gastrointestinal glands. Protective function, also chewing, and saliva ensures of integrity of oral cavity. Its main function of oral cavity. Next, esophagus. Esophagus is a narrow muscular funnel-shaped tube with an extension of its caudal part. Extension with an extension of its in its caudal part. Extension here. Its length at birth is 10 centimeters. 5 years old, nearly 16 centimeters in average. In 10 years, 18 centimeters. In adults, 24 to 25 centimeters. It's a length of esophagus. The width of the esophagus in newborn width or maybe diameter, right? Nearly 7-8 millimeters. In 1 year 1 centimeters. In 12 years 1.5 centimeters. Contact of esophagus with surrounding internal organs leads to the formation of 3 contractions. In the initial part here, at the level of bifurcation of trachea and the diaphragm. In the area of contact with esophagus with posterior wall of the left ventricle during esophagoscopy here. When passing the endoscope through this department, various rhythm disturbance may occur, which must be taken into account when conducting the study, the procedure. Oh, you can see this one of problems of early age patient. In the newborn, there is a relatively weak development of anatomical narrowing of the esophagus, insufficient development of muscles, elastic tissue. There is a good development of its submuscular layer. The mucus is rich in blood vessels. The walls of esophagus are thin. Unlike other parts of gastrointestinal tract, the esophagus has no serous membrane. The longitudinal folds of the esophagus mild. Its mucous membrane is lined with a multiplayer flat epithelium. The esophagus itself is relatively short. The transition of esophagus to the stomach on all periods of childhood is located at the level of 11 thoracic vertebra. The esophagus flows into the stomach in a certain angle, with called the angle of this G's. In newborn, it is 90 degree. With such of magnitude, there is a lack of cardia. The function of esophagus is to move food from mouth to stomach. You can see on X-ray gram congenital atresia of esophagus in premature baby. The X-ray show that the contrast probe inserting through the low nasal passage into esophagus and bent to by a loop. Gas bubble of the stomach is missing without here. It's variants of disorder um, development into uterine development of esophagus. Stomach. Stomach in newborn, the stomach is oblique with 5-6 months horizontal position, and when the child begins to walk, to vertical position. The stomach of the newborn has a saucer-like shape, then becomes rounded with the introduction of thick food take from a retort or hook. With age, there is a gradual increase in weight, mucous surface, and stomach capacity. Where is the physiological anatomical capacity of stomach? There is a physiological anatomic capacity of stomach. It's two very different parameters. Physiological capacity and anatomic capacity differ. The physiological capacity is less than anatomical, and at birth is only 7 milliliters. Physiological capacity 7 milliliters at birth, and you must remember about it because just one feeding volume of mother's milk in this period, just only 7 milliliters just after birth. You study baby's feeding and remember about it. On the first day of life after the start of internal nutrition, physiological capacity of stomach is increased to 40-50 milliliters to 10 days up to 100 milliliters. By the end of the first year's life, it's 250 milliliters, 300 milliliters. And for baby of 10-12 years old, it's about 1,300-1,500 milliliters. In a newborn child, there is a weak development of button and the cardiac part of the stomach. The button of stomach is formed by 10-11 months. The formation of cardiac department is completed only by 8 years. A relatively short esophagus contributes to the fact that part of the stomach is in the chest cavity and part in the abdomen. То есть, you remember the border or between chest cavity and abdomen, we have diaphragm. Yeah? The pyloric department is functioning well, development already at birth, and this make it possible to compare the stomach of the child to the first months of life with an open bottles and predisposes children of the first year's life to regurgitation and vomiting. You remember it's a pyloric part of stomach of baby. This cardiac part department of stomach. Such as result, here we have good muscle development, here not good. Such as result, we have predisposes children of the first year's life to regurgitation and vomiting. The relative surfaces of the gastric mucosa of newborn is small, which reduce the risk of denaturation and hydrolysis of immune substance. With the age, the surface of mucus intensively increase. In the first 3 months after birth, in, in 3 times, to 2 years in 5 times, and to 15 years old in 10 times increase. Surface of mucus of stomach. The very mucous membrane of a stomach in newborn child compared to adult is relatively thicker. It's tender and rich in blood vessels, poor in elastic tissue. Its folding is not enough. The muscular level of gastric wall, especially longitudinal and oblique, are poorly developed, little differentiated, just a little differentiated. The gastric juice. The gastric juice of a newborn and infant contain the same enzyme as that of adult. Pepsin, gastrichen, hemazine lipase, but the enzymatic activity is reduced. Lipolysis in breastfed children is due to lipase of gastric juice and lipase of female milk. A characteristic of features of lipase is the ability to carry out hydrolysis of fat in the absence of bile acids and at optimum action in a neutral or close to it environment. Hydrochloric acid begin to be actively secreted into the lumen of stomach from 2 months of age. The number sharply increased after the introduction of baby solid foods. The pH value in the stomach of newborn immediately after birth nearly 4 to 6.5. A few minutes after the first feeding, it's reduced by 1.5 to 2.5 pH. By the end of the first week of life, the pH of gastric juice is 4 to 6. Is 4 to 6. By the end of first year's life, 3 to 4. Acid forming function and proteolytic activity of gastric juice in children of the first year of life depends of types of feeding. It's higher in children who are on artificial and mixed feeding. Low acid peptic potential of stomach in newborn ensures the safety of immunoglobulins, especially immunoglobulin A, lymphoid cells, and macrophages contains in colostrum and mature mother's milk, which in turn protect the child after birth from massive bacterial invasion during the period between its own active immunity is just beginning to form. The duration of food in stomach depends of its nature. In a healthy infant with proper feeding, breast milk is delayed in stomach 2 3 hours. If it's use cow milk, the stomach full during 3-4 hours. Fats and proteins increase the duration of food in stomach and the infant more inhibitory effects of proteins, while in elder fats. The function of stomach, you must remember about it also. Depositing food, the first chemical uh, treatment, treatment of food with gastric juice, mixing food with digestive juice and moving it to duodenum, mixing food. Uh, Absorption of substance, also one of the most important function. Excretion into stomach cavity of metabolites and substance entering the body from the outside, drugs and ads. Formation of activity substance involved in the regulation of gastric and other digestive glands, histamine, gastrin, attack. Bactericidal and bacteriostatic effects of gastric juice, very important function of stomach. Initial hydrolysis of proteins and fats, and mechanical breeding of food. Mechanical breeding of food. Now, okay, let's go to intestine. In newborns, compared with adults, the rate of intestine relatively to rate of the body is relatively greater. In newborn, 8.3 to 1. In adults, 5.4 to 1. It's relation, ratio between rate of intestine and rate of body. This is because the anatomical rate of the intestine increase more slowly than growth of child, growth of body. It's weakly fixed by a thin and long mesentery to the back wall of abdominal cavity. During the first years of life, the rate of mesentery continue to increase with increase of mobility of small intestines and causes relatively frequent intestinal inversions and interceptions with at this age. By the age of 7, the mobility of small intestine decreases due to the large liver and development of pelvis intentional intestinal loops. In young children are more compact but occupy an instable position. Innervation of small intestine is carried out due to sympathetic and parasympathetic part of an autonomic nervous system. In the small intestines of young children contain a lot of gases, gases. This is the amount of which gradually decrease in volume and disappear by 7 years. In adult, in the norm gas in the small intestine is not, but in children's younger than 7 years old, it may be present. Features of innervation and structure of muscular system of the small intestine. The abundance of gases alone of reduced activity of small intestine lactase contributed to emergence of infant colic. infant colic, one of the most often problem, especially in early age for baby first part of first year's life. It's a complete complete reasons of this situation. The intestinal mucosa is tender. It has a lot of blood vessels. The volume of blood in mucus is 10 to 30% of total volume. Its permeability is increased and contributes to penetration into the blood of undiluted constituent particles of food, toxic and allergic substance, microorganisms. Willi and folds of mucous membrane of the small intestine newborn are well developed, but they are lower than in elder children. The script are deeper. The rate of regeneration of intestine epithelium is higher. Compare with adult children has larger intestine glands, larger than adult. Sympathetic vessels lymphatic vessels are numerous and have a wider lumen. The lymph flow from the small intestine does not pass through the liver, so the product of absorption together with lymph get directly into circulation blood. Due to the low synthesis and transport of bile acid in the small intestines of young children, the absorption of fat is reduced. You must remember about this absorption of blood, not such as adult. In the small intestines, the main stage of the complex of process splitting and absorption occur. Membrane digestion dominates in infants during the period of milk nutrition. The secretory apparatus of the small intestine for birth as a whole is formed. Even in newborns in intestinal juice, you can determine the same enzymes as in adults: enterokinase, alkaline phosphatase, lipase, amylase, maltase, nuclease. But the activity is low and increases with age. The features of proteins assimilation in young children include the high development of pinocytosis by epithelial cells of the intestinal mucosa. As a result of its milk proteins in children of the first week of life can pass into the blood in a little changed form. This can lead to appearance antibodies to cover milk proteins. In children older than 1 year old, proteins undergo hydrolysis with the formation of amino acids. Large intestine. The growth of the colon in the interior period legs begin to the growth of small intestines and the newborn's ratio between the weight of small intestine and the colon large intestine is 5, 5.6 to 1. Up to 3 years, both parts of intestine grow equally intensively, but subsequent period, the colon grows more rapidly and ratio between two parts of intestine become to 4.6 to 1. In newborn, the second is high, the ascending colon is shorter, then descending, the sigmoid colon is long and form excesses. The large intestine has a rate equal to growth of child. The appendix of children compared with adult is shorter, 4 to 5 centimeters in newborn and 9 to 12 centimeters in adult. And because of long mesentery, it has good mobility and can be found in any parts of abdomen. But most often its appendix is rectocecal in the picture you can see different position of appendix in especially in early age. Ascending part of colon in neonates is short and has a rate of 2 9 centimeters late begin to increase after a year. The transverse part of colon in newborn is located in the epigastric region, has a horse's show shape, and by 2 years occupies in a horizontal position. The cavus of the intestine is poorly expressed. The mesentery of transfer part of colon is thin and long, so it's more easily when filling in stomach and small intestine. The distended part of colon is weakly mobile. Sigmoid colon compared with other part of intestine in newborn is very long and mobile, and the process of its growth continue to almost all of life with relatively decrease in its rate with age. Due to undevelopment of the pelvic sigmoid colon, L children under 5 years is located in abdomen. Then she falls into the pelvis. Due to the sharp shortening and mesentery accumulation of fat around it by the age of 7 years old, the mobility of sigmoid colon is lost. The rectum in children in the first months of life is relatively long and when filled can take a small pelvis. It's ample of little differentiated. Fatty tissue is not development, as a result of which the ample is poorly fixed. The final position of rectum take up to 2 years old. Um, it has a well-developed submucous layer, but intestinal mucosa is poorly fixed. so, as a result of which, with an increase in intra-abdominal pressure, abdominal tension with a strong cough, straining its loss prolapse can be observed. Anus in children is most dorsally than in adult. Dorsally. Dorsally. Functional features of intestine. Motor function of intestine motility consists of pendulum-like movements that occur in small intestines, due to which there is mixing of its contents, and peristaltic movements promote the hemos toward the colon. For the large intestine, antiperistaltic movements are also characteristic, thickening and forming feces. Motility in young children is mole activity, which contributes to frequent bowel emptying. In infants, the duration of passage of food gruel into the intestine is 4 to 18 hours, and in older children, about a day. High motor activity of intestines in combination with insufficient fixation of its loops determines the tendency to invagination. Invagination, very serious problems of babies in early age. Defecation. During the first hours of life, there is discharge of meconium. Meconium is a primary feces or regional features. Um, an adhesive mass of dark green color with pH about 6.0. Meconium consists epithelium, mucus, rhinozoom, amniotic fluids, bile pigments, and eggs. On the 2/3 days of life, the meconium mix with feces, and with the fifth day uh, cold takes a characteristic appearance. In children of the first months of life, defecation usually occurs after every or each feeding. It may be 5 to 7 times per day. In children from second months of life, 3.5, and in 1 year old, it's 1-2 times per day. With mixed and artificial feeding, defecation is more rare than children with natural feeding. Feces in children's breastfeed mushy yellow and acid reaction and so smell. Is artificial feeding stool has a thicker constantly lighter, something with gracious tinge, neutral or even alkaline reaction with a more pungent odor. The golden yellow sclerose fetus in the first months of child is due to presence of bilirubin, greenish biliverdin. In infant, defecation occurs reflexively without any partitions of the will. From the end of the first year's life, in a healthy child, defecation gradually becomes inhibitory act. The intestine of a fetus in newborn is sterile during the first 10 to 20 hours, a septic phase. Then begin colonization of intestine by microorganisms. The second phase, 2 4 days. The first, uh, the third phase, stabilization of microflora, lasts from 6 months to 2 years old. The formation of microbial biocenosis of the intestine begin on the first day of life. By the seventh, 19th, or ninth day of healthy full-term newborn, bacterial flora is usually represented by bifidobacterium bifidum, lactobacillus acidophilus. With natural feed, amount of the intestinal microflora privilegium bacterium bifidum, with artificial almost is equal quantities there Lacidophilus, Lactobacterius acidophilus, Bifidobacterium, Enterococci, and normal Escherichia coli. The transition of nutrition characteristic of adults causes a change in composition of intestinal microflora. Pancreas. The pancreas in newborn is small and located higher than adult. Due the weak fixation to posterior wall of abdominal cavity, in newborn it's more mobile. The most intensively iron grows in the first 3 years and puberty period. By birth and the first months of life, the pancreas is not sufficiently differentiated, abundantly vascularized, and poor in connective tissue. The endocrine part of pancreas at birth is more development than exocrine. Pancreas juice contains enzyme, provides hydrolysis of proteins, fats, and carbohydrates, and bicarbonates. Great alkaline reaction of medium necessary for activation of enzyme. In newborn, there is release of a small amount of pancreas juice after stimulation. The activity of amylase and bicarbonate capacity are low. In the transition to a normal diet, in which more than half of calorie need are covered by carbohydrates, the activity of amylase increase rapidly and reaches maximum value by 6 to 9 years. The activity of pancreas lipase in newborn is low, with determining a larger role of hydrolysis of fat lipase in of the salivary glands, stomach, and breast milk. Proteolytic activity of pancreatic secretion in children of the first months of life is quite high. A significant impact on the activity of pancreas has a type of feeding with artificial feeding. Enzyme activity is duodenal juice in 4-5 times higher than in natural feeding. The liver at the time of birth is one of the largest organs. Its lower edge protrude significantly from hypochondrium, and right lobe can even touch the crest of the ileum. In human, weight of the liver is more than 4% of body weight. In adult, it's only 2% of body weight. In postnatal period, liver continue to grow but slower than body weight. Due to the different rate of increase in weight of the liver and body in children from 1 year to 5 years of life. The age of the liver comes out from under the right hypochondrium and usually left 1 3 centimeter below the rib arch along of medial clavicular line. With 7 year, the low age of liver for, from the under the rib arch does not come out and in calm position is not palpated. In the middle line does not go to beyond the upper third of distance from the navel to the xiphoid process. The liver is full-blooded, resulting of rapidly increased infection, intoxication, and circulation disorder. The fibrous capsule of liver is seen about 5% of liver volume in newborn is representative of hemopoietic cells. Hemopoietic cells, really. Hemo, Hemopoiesis present just after birth, sometime in liver. By the age of 8 years old, the morphological and histological structure of liver becomes the same as in adult. No liver function. We repeat once more. The formation of bile occurred already in the uterine period, but bile formation is early age is slowed. With the age, ability of gallbladder concentrate bile increases. The concentration of bile acid in hepatic bile in children of the first years of life is high, especially in the first day after birth, which can be causes of frequent development of subhepatic cholestasis. Bile condensation syndrome in newborn. For newborn immature of the all stage of hepatic intestinal circulation, bile acid characteristic insufficiency of the captures by hepatocytes and excretion through the tubal membrane, slow of bile current, dyschargia due to reduced synthesis of secondary bile acid, and low level the resorption in intestine. Children produce more atypical, less hydrophobic, and less toxic fat acid than adult. The accumulation of fatty acid in intrahepatic bile ducts causes increased permeability of intercellular compost and increased content of bile components in the blood. The bile of children of the first months of life contains less cholesterol and salts, which determine a rarity of stone formation. In newborn, seeds are correctly mainly with taurine. In adult, with glycine, taurine conjugated are more soluble in water and less toxic. Relatively high content of bile taurocolic acid determine the rarity of bacterial inflammation of biliary tract in children in the first years of life. Very rare situation. Enzyme system of liver, which provide adequate metabolism of various substances, are not mature enough for birth. Artificial feeding stimulated their early development, but leads to their disproportion. After birth, the child decreases the synthesis of albumin, which lead to decrease albumin globulin ratio in the blood. In newborn, in first days of life, insufficient activity of gluconyl transferase is noted, is precipitation of the conjugation of bilirubin with glucuronic acid and formation of water-soluble direct bilirubin. The liver performs a barrier function, neutralizes endogenous and exogenous harmful substances, includes toxins that come to intestine, and taking part in metabolism of drugs. In young children, their neutralizing function in the liver is not sufficiently developed, not sufficiently developed, sufficiently. Gallbladder of newborn is usually hidden by the liver. Its shape may be different. Its size increases with age, and by to 10-12 years, the rate increases by about 2 times. The rate of bladder bile excretion in newborn is 6 times less than adult. It's microbial biocenosis. We can and semiotic of lesion of gastrointestinal tract. Several symptoms you can see here. In oral cavity, may be present diseases of oral cavity indicate other diseases. The putrid smell in the widespread carries ulcerated stomatitis, foreign body in the nose, much coated tongue, purulent tonsillitis, adenoiditis, and sinusitis. Intestinal dysbiosis. This sweet smell appears at the beginning of diphtheria and becomes stinking. The smell of fresh fruit accompanied to acetonemia, which developed in diabetes, acetonomic vomiting, acetone poisonous, and other organic solvents. The smell to fresh liver is observed as severe hepatitis, acute yellow liver atrophy. Special smell causes of poisonous or alcohol gasoline intake. Change the oral mucus. Children of breastfeeding as common lesion of mucous membrane of the oral cavity is like fungi candida albicans, cold thrush candidiasis, and you can see here. Catarrhal stomatitis is characteristic by the appearance of the bright redness with delicate walled bubbles on edge of tongue, on mucous membrane of his cheeks, gums. After you can see no on low pictures it. Limited spotty redness of soft palate is observed in measles, scarlet fever, angina, acute respiratory diseases. In the prodromal periods of measles and inner surfaces of the cheeks, you can see plague in a form of semolina with mumps infection, redness of mouth and excretory tracts, duct of parotid saliva glands is noted. And also different you can see the ulcer such as a result of mucus damage during coughing on in down picture. Different variants of pathological increase of mass of tongue, macroglossia, is observed in down diseases, hypothyroidism, muscles from of glycogen diseases, lymphangioma, and cyst of tongus, hypothyroidism, acromegaly, edema in allergic reaction. Many very interesting also surface. Tongue can be deep geographic tongue, desquamative glossitis, typical for patients with allergy. On the left pictures you can see the folder tongues abnormally anomaly of development. It's different types of you can see different color of tongue and it's on different signs of different signs of for different pathology. Science, vomiting science, very important. Science of gastrointestinal pathology and another variant of pathology. Regurgitation, it's according to for early age patient is normal, for elder patient is pathological sign. Okay, today we can finish. Thank you for attention. I hope you have some new knowledge about digestive system children. Good luck.